So I pose this because this is a common question that we get from reporters and others. Is food allergy a legitimate health concern? There was one individual that had a prominent column in a prominent news agency that essentially wrote several articles over a period of 6 months saying that he didn't think food allergies were legitimate and so forth. After a period of time, his son actually developed food allergies, unfortunately. But it's kind of, people take it for granted and don't really understand it. And there's some misconceptions about it. So that's what we'll discuss today. So food allergies, I would say, do continue to be a major public health issue, not only in the U.S., but around the world. We're seeing several what we call westernized countries or more developed countries such as the U.S., UK, and others that have been reporting increases in the prevalence of allergies. In the U.S., a report done by the CDC back in 2008, which indicated an 18% increase in allergies in children under the age of 18 years. And again, they're trying to figure out what's attributing to the drastic increase that we're seeing. Specifically, we saw peanut allergy, which tends to be one of the most potent allergens, one of the most allergens that can cause a lot of severe and life-threatening reactions, increase in the U.S. population. So over a period of about 5 years, we saw an increase between a doubling in between 0.4% and 0.8% of the U.S. population. Further, I think they repeated the analysis in 2008, working through the statistics, but they're going to show that there's perhaps another doubling of the prevalence of peanut allergy in the U.S. The UK had a similar doubling over approximately the late 80s to 1990s. So again, it's an allergy that's continuing to increase. Other allergens, and we'll talk about those, are seeing a similar trend. So what's contributing to that? Also in another study, they noted that food allergies tend to, children that develop food allergies earlier also have a higher risk of developing other, what we call atopic or allergic type disorders. So asthma, for example, atopic dermatitis, which is a chronic rash that you get. Also allergic rhinitis, so your nasal pollinosis type allergies can contribute to that as well. So we're seeing a lot of increase that all of these things can contribute to the burden of that public health issue. So pose the question of where are we now on this key issue of food allergies? Why are we seeing perhaps this increase? And there's several contributing factors. So one is the increase in awareness primarily. So we've seen over the early or late 1980s to early 1990s medical journal publications that really highlighted the severity and really brought about perhaps some prevalence of food allergies. So that brought that particular key issue into the view of the consumers as well as the media. With that, we also saw the advent of more advocacy groups or support groups getting organized to help individuals with food allergies. So again, consumer awareness is growing. We also see a trend through food industry and elsewhere of value-added products. So with these, I mean things labeled as gluten-free, as you'll probably see that as all the time now, and certain sections of grocery stores have dedicated areas for gluten-free. Dairy-free, peanut-free, or allergen-free, or other ones that you may come across. These all bring about, again, an awareness, perhaps not necessarily about what allergies are, but a free from might stimulate a consumer to say, well, do I need to be worried about gluten? Should I be eating gluten-free? So again, it brings about a top-level awareness, perhaps the allergy issue or the gluten issue. We also have improvements in detection and diagnosis for that matter. So again, we're seeing food industry being able to track for those allergens, as well as improved diagnostics, so the clinicians can tell consumers that they do have this food allergy or they do not have a food allergy. And from a company standpoint, there's also a company liability. So as I'll show later, there's a number of food allergy recalls that are common in the U.S., and those all bring about a negative publicity perhaps, especially if that product's been implicated in an allergic reaction, a severe allergic reaction, or perhaps even a fatality in some cases. So that does have a financial impact that the company will be aware of, the media will be aware of as well. From the consumer standpoint, that increased awareness comes from a number of different areas. Of course, they're looking to the food industry to see about whether or not the product contains those allergens that they may have concern. They're also perhaps having complaints that are reported to the food industry, so readily aware of these issues as well. So as a result, food companies are much more alert, and there's several things that food companies are aligning themselves with as far as labeling goes to highlight those allergies. And media coverage from two primary publications from Canada and the UK that I'll discuss one of. Those brought about a lot of awareness as well. And we have the consumer groups that certainly are helping bring about awareness of this issue. So this is one of the highlights, I would say, that really brought about allergy awareness back in 1993. So this was in the Times, where unfortunately the reporter that issued this, his little girl died because she had eaten that lemon pie. So with that, it brought about a personal as well as a awareness to that article, as well as bringing it to the face of really the world, because it's really caught on everywhere. For a company, you certainly don't want to be implicated, your product implicated in a fatality, let alone a allergic reaction. So this brought about, from a food industry awareness standpoint, really began to stimulate the need to start addressing food allergy issues. At that point in time, there was very little technology to help them manage food allergies. There were no detection systems for them to utilize in the facilities, so they didn't really know if they were cleaning well enough to ensure that the peanut would not be a concern in a product that was just changed over to a non-peanut containing product. So again, it's there's been a lot of things that have come about over the last few years. From a clinical standpoint, we do see an increase in the prevalence of food allergy for a number of perhaps different reasons, what I'll discuss in a little bit. We see that food allergy awareness continues to increase in the medical community, and they're seeing a lot of individuals actively looking for a diagnosis. So they see more consumers associate because they've read it somewhere, they've been online, they've had an allergic reaction, they can associate that particular product with that reaction. So it's, again, there's a number of different ways that they're coming about thinking they're having an allergy and then going in for that diagnosis. With that diagnosis, we have better technology now than we did back in the 80s and 90s to better assess whether it's a true food allergy or if it's perhaps an intolerance or something else that may be contributing to that adverse reaction. And as we see through some of the publications, we see an increase in prevalence of severe allergic reactions. Now that may be just in part because there's more awareness about food allergies. Clinicians are readily writing about what they're seeing in their practices. And the severe ones are certainly always the ones that tend to be more noteworthy, so they warrant publication. So there's, again, differences in what the prevalence, why the prevalence may increase. Yes?
From the diagnostics point is, I'm not very familiar with this at all. When they go in, sometimes they do a patch thing. Is that food allergies?
Right. They'll do, what they do is a skin prick or patch test, and that's usually, they'll take a history first and kind of ask you a lot of questions about what your exposure is, what do you think contributed to it, and so forth. And that helps them narrow a panel of several hundred different individual allergens that they may put on your skin to a few, maybe 25 or so. If food's implicated, then they may think about, well, which ones may be in that product that you ate and narrow it to a set of tree nuts and peanuts and things like that. Same premise though, what you're doing is trying to stimulate the immune system. If you have a reaction, it's likely that the immune system is reacting, and it shows that you have perhaps food allergy. That's not a completely definitive test, so they may also take some blood to do blood work to see if you have the right antibodies or things that will recognize those proteins of interest from the allergic source, and that also gives you a second backup to show that you're allergic. So, but history and 2 different diagnostic tests are the primary way they're doing things right now. So here's a few of the noteworthy publications from very prominent clinicians in the U.S. from 1988 to 2001. These really brought about, again, awareness to the severity and potential fatalities that can be involved in the allergic reactions. In 1988, there were very little, if any, publications on fatalities to food allergies. In this particular publication, they indicated or reported on 8 different deaths, all to packaged food products, which was very alarming to the industry as well. And then again, there's several others that have implicated 12 or 32, ranging from anywhere from small infants and children, ages 2 and up, all the way up to adults that could have a fatal allergic reaction. So again, it's a public health concern that outreaches over all age groups. From a food industry standpoint, that's where I try to help out with the research that we conduct and the outreach programs we do. It's trying to bring about this awareness. And of course, they're well aware of the increased consumer awareness. They know that there's potential impact of severe allergic reactions. They've perhaps been involved in a recall, hopefully not. Or they've certainly read about and are aware of recalls and the potential it has on the financial impact and brand marketing for that company. So again, they're trying to avoid that at all costs. And then there's increased governmental regulatory agency oversight of allergens and interest in allergens. But the key one, I think, is the last point. I'll show a little bit later about the threshold, or that dose that can cause a reaction. And you may be surprised at just how little of a dose can cause a reaction in some very exquisitely sensitive individuals. So from the regulatory standpoint, I show this slide. It's called what they call the report food registry. So when a food industry believes they may have an issue with either a microbiological contaminant, chemical contaminant, food allergies, something of that nature, the company is supposed to put their data into this registry so that FDA can evaluate and decide how they're going to go about a recall perhaps, or maybe not a need for a recall. With this one, you'll note that in the 2010 through 2011 reporting year, allergens were actually only were number 2 only to the number of cases of registry cases of salmonella. So again, very prominent in the number of potential recalls implicated in the U.S. This was a 9% increase from what they had seen in the reporting year previous. So it definitely shows that there's an increase in trend, perhaps partly because there's an increased awareness by government and also wanting to try and more control those allergens more. This is a slide looking at the number of recalls issued by FDA from 1988 to 2012. And what you see is, of course, an increase, a continuous increase for the most part, over the reporting years that we've tracked this information. Again, a lot of contributing factors, increased awareness and regulatory oversight, but needless to say, we saw a lot to do to try to get those numbers down. We saw our highest levels just over about 230 recalls that were issued last year, in the U.S. In 2012, this is reflective about mid-June. Looks to be that we're well on track to see similar levels that we saw in 2011. So again, it's a major concern that still needs a lot of work from the food industry standpoint. USDA is the agency that monitors the meat, poultry, and egg divisions. So they're looking at a number of recalls as well, and had their highest level ever achieved in 2011. Again, we're on track in 2012. This was in part because there's a lot of companies, you think about meat companies, you would think, well, that's a steak or something of that sort. There's now a lot of emphasis on breaded products or ready-to-eat type products, and that can bring in different allergens as you bring in different ingredients and put that into the meat product. So as a result, we're seeing perhaps an increase in the number of allergens that are introduced into the food facility, and then the number that need to be managed. So when I say, I highlighted that point on thresholds, or that eliciting dose. So the key question is, how much is too much? And what the answer is, as we're finding out through clinical research, is it's milligram amounts, or very, very small amounts. From a concentration basis, it's a part per million. So a microgram per gram or a milligram per kilogram of material. In some of our work in which we're trying to establish what an overall population threshold would be for peanut, we've noted that there's a large diversity in the differences in that eliciting dose, that amount that causes the initial reaction in peanut allergic individuals. We've noted that it's a 1,000-fold difference. So in this case, the highest level, 400 milligrams in this case, we've actually seen some that are up around 10 grams, so it's even higher. But this 400 milligram is a representative of a Spanish type peanut. So the cocktail peanuts you may enjoy while you're having a beverage, perhaps. Of course, I forgot my cell phone. So that Spanish cocktail peanut could cause a reaction in an individual that has a sensitivity to about that level. But on the other end of the gamut, we see individuals at our lowest level reacting to about 0.4 milligrams, or 1/1000th of that Spanish peanut. So a very small amount. What I also like to do is show from a concentration basis just exactly what food industry is trying to manage. So in these 3 different jars, I have 3 different concentrations of what we'll call peanut, for example. So you'll see in sugar, there's 100 parts per million of black pepper in this case. And you can see how many black pepper flecks there are in this jar. At 100 parts per million, this is certainly enough to elicit a reaction in probably half of the individuals here. Again, it's dependent on dose, as this is a concentration. Those are doses, so it depends on how much you eat. But this, given a concentration of 100, you'd certainly see a reaction, perhaps a severe reaction. So I'll go ahead and send that one. At 10 parts per million, again, as you continue to look through, harder to see, but again, you could potentially have allergic reaction at 10 part per million, given one of those more exquisitely sensitive individuals. What food industry is challenged with is trying to get below detection limits to ensure the safety of the allergic individuals. So this one has 1 part per million, or 1 piece of black pepper in this jar of sugar. So they're trying to think about trying to clean your kitchen and making sure you don't have a speck of pepper anywhere. What they're trying to do is clean food facilities with equipment that may span several football fields in length, and they're trying to make sure that they don't have that 1 speck of pepper in there. So it's in there.
I don't see a 10.
It's tough. It is. So from an economic standpoint, you also have to consider that food allergies are not only the individual that has the food allergies, but it's also the family members that have that are living with the individual that has the food allergies that contribute to the quality of life and the buying, the social activities that these individuals do. So it's, you know, when we quote numbers of prevalence that there may be 1% or 2% of individuals being allergic, you also have to remember that family members are involved, so there may be an additional 4 to 5 individuals in that household that are now avoiding particular products because they have allergens that their individual family member can't tolerate. Friends are also quite diligent in trying to help protect their best friends to ensure that they don't have allergic reactions. So you may have an additional number of people that are also avoiding. So from a food industry standpoint, an overall economic standpoint, you have to recall that and remember that there's quite a few individuals that could be avoiding your product, and we'll talk about labeling a little bit later, but avoiding your product because of the way you've labeled it or because of the allergens that you may be using. And that's not to say that these allergens shouldn't be used. They're very wholesome, hearty products and provide a lot of nutrition. It's just you have to manage them well enough to ensure safety for all individuals. So what are food allergies after that long explanation? First about the prevalence, because you know, when I poll a room, we have allergies, but perhaps it's not truly allergies, it's maybe sensitivity. It may be something that they believe is an allergy, but they've never been diagnosed. So in the US, 1 in 5 individuals believe they have a food allergy, but if you really begin to break that down and look at the number of individuals in clinics, you see that between 6 and 8% of infants and children, primarily to the age of about 5 to 6, have food allergies, and about 3.5 to 4% of adults have food allergies. So this is going to be a little hard to see, but this kind of gives you an overall basis of what food sensitivities are. And so that way we can get a better idea of what food allergies are. So if we start at the pyramid, food sensitivities can be anything that can cause an adverse reaction. So you may have a stomach ache after eating something. But is that truly because it's a food sensitivity, or is it something secondary? So perhaps you're on a prescribed drug for a medical issue, and that kind of disrupts your intestinal system a little bit. Eating a little bit of some food may also contribute to that, and so we would call that a secondary food sensitivity. Primary food sensitivities have both immunological based, so your body, your immune system that would fight an infection, for example, is beginning to fight a food component. So there's immunological, and then there's food intolerances, and this is where the common misconception comes in. These food intolerances, so something like lactose intolerance, is not a true food allergy. It's an intolerance. It's a lack of your ability to process that particular component, but it has no adverse or life-threatening effect in that case. With immunological, we have food allergies, which are broken down into what we call IgE-mediated food allergy, or the true food allergy, and then non-IgE mediated. The immune system in this case is still involved, just different mechanisms. With this one, the delayed hypersensitivity type reactions would be something like celiac disease, or gluten sensitivity, where you're reacting to gluten proteins from wheat, rye, or barley. It's a little different mechanism, but again, it's an immune response. The ones that we're going to talk about the rest of the time are the IgE-mediated, or those true food allergies. So again, what's happening in this case is it's a heightened response to what would normally be in the vast majority of individuals a normal protein source from that particular food. And for whatever reason, allergic individuals' immune system will begin to recognize that as something similar to a bacteria, for example, think that it needs to get that, react to it and remove that, and which causes the inflammatory response involved. Interestingly, IgE which is the antibody that's involved in food allergies, was originally developed in the human human body, they believe, to fight parasitic infections. So, as I talked about earlier, I said there's an increased prevalence in the U.S. or other westernized countries. In part, perhaps the theory is that we see less parasitic infections, perhaps less bacterial infections, and so our immune systems aren't challenged on a daily basis like they used to be, or like people in less developed countries are. So as a result, for lack of more scientific terms, the immune system becomes bored and begins to attack what they think may be foreign proteins, which would be normally harmless food proteins. What we see in the mechanism of food allergies is a sensitization phase. So you're initially exposed to that allergen. Your body begins to build that immune response to it, and it will then remember that it's seen this foreign protein. On the elicitation phase, that's when it really begins to get that subsequent exposure and react at that point. You have the immune response readily available. It begins to react and give you the symptoms that you see. I'm not going to show this right now, but it's for lack of time. But this gives you, it's a nice video that you can kind of see. It walks you through the sensitization phase and how you can become exposed orally by ingesting foods, and then how the immune system will respond to that protein. And you can access that on our website and view that short animation. Symptoms involved can involve a number of different organ systems, anywhere from skin to the GI tract, of course respiratory. If you get severe reactions, cardiovascular system can be involved, which you can get hypotension, very dangerously low drop in blood pressure. And then we can also have multiple organ systems involved, in which the most severe reaction would be what we call anaphylactic shock. And it's important to note that these symptoms are different for each individual, perhaps at each different exposure. So sometimes you could just have skin reactions. Other times you could have skin and GI reactions or so forth. So it's, again, symptomology is quite different. So what anaphylactic shock is, again, it's a generalized shock reaction, and you have multiple organ failure that's being involved. Again, a lot of times what you end up with is that cardiovascular system involved, in which you have that hypotension or severe loss in blood pressure. Then that's also involved is cardiac arrhythmia, or the irregular heartbeat that can be involved. If not treated immediately with epinephrine, it can be fatal. And so usually within 15 or 20 minutes at the very most, you have to be treating a severe allergic reaction, or it may not be able to be clinically turned around when you get to the hospital. The severity is a little difficult to assess, but there's a few estimates in the U.S. that indicate that there's somewhere around 50,000 anaphylactic reactions per year, somewhere around 2,000 hospitals, perhaps 100 to 150 deaths estimated, primarily due to food allergies each year. Now, we don't have a real good tracking system in the U.S. to note that someone that came in with an anaphylactic type reaction, it was due to exposure to a food allergen. So those are best estimates based on what a large clinical population in Minnesota had viewed over a number of years, and that was extrapolated to the overall U.S. Again, with this, as many are well aware, there is no active treatment for food allergies, so avoidance is the only thing that can keep them safe. This is also a good slide that I like to share. Again, a lot of information here, so I'll just briefly summarize what we're seeing. This is for peanut particularly, but it holds true for all allergens. So this gives you an idea of some of the theories about why we're seeing an increase in food allergies. What are those potential risk factors as you are thinking about how you become sensitized to food to particular food allergens. So certainly there's perhaps a genetic predisposition. It's been noted that if both parents have food allergy or allergy in general, so it could be a pollen allergy, that gives the children more predisposition to develop allergies as well. Exposure, whether it's through skin contact or dietary contact, could contribute to how you become sensitized to food allergens. Use of antacids, for example, that increases the stomach pH, which you're seeing from having various issues like gastrointestinal or stomach issues. That actually increases the pH, which then doesn't allow the proteins that are involved to be broken down as readily. So perhaps that's a route where intact proteins now are able to interact with the immune system. Differences in the way we cook things and how we have exposure to different processed foods perhaps is a difference between what we saw 20 years ago and now. And perhaps some of those different processing methods change those allergens and make them more allergen. Again, these are all theories that are not proven at this point. And other things such as timing and dose can make a difference as well. So does breastfeeding or maternal consumption of allergens translate to allergy in the infants? And there was, for a number of years, a belief that that was the case. They're starting to think that perhaps we had gone about our avoidance diets in the wrong manner, and now we're actually they believe that maybe high doses early on in infancy actually will drive tolerance rather than avoiding that for a long period of time. So what are the key allergens that we're interested in? The primary ones are what we call the big 8 allergens that are seen worldwide. So these involve peanuts, tree nuts, milk, egg, soy, fish, shellfish such as shrimp, and those account for approximately 90% of the prevalence of food allergies. The other 10%, there was a study done by a colleague of ours at the University of Nebraska a number of years ago that if you dig through the literature, you'll find well over 160 to 200 different food sources that have been implicated in allergic reactions. So really anything that has protein in it has the chance to be an allergen. It's just whether you have enough exposure and some of the other factors involved with the proteins themselves that can contribute to development of allergy. As I mentioned, there's differences in prevalence between children and adults. So in children, we primarily see milk, egg, and peanuts as the primary allergens early on in life. And again, that's partly because of the introduction at certain points in time that they become exposed and potentially become sensitized. In adults, we see milk tends to go down in adults over time, same with eggs. So you begin to build tolerance over time, but not all individuals. And then peanut seems to stay pretty consistent. So that's one where developed early on, it's likely that only about 15 to 20% of peanut allergic infants will develop tolerance. And so it becomes a real lifelong affliction that has to be controlled throughout life. And then interestingly in the US, we see crustacean shellfish, so shrimp being the one that causes the highest prevalence of allergic reactions in the US. But also with that, we've noted that the severity and sensitivity of allergic reaction or shrimp allergy tends to be higher. So you need a higher dose to be able to actually have that allergic reaction, whereas peanut tends to be that very small amount that we showed earlier. So the causative agents, of course, are proteins that I have mentioned. They tend to be very hardy proteins, so they're resistant to heat no matter how high you process a food or use different processing techniques. They by and large stay very resistant. They're resistant to proteolysis, so that digestive process tends to not break down those particular proteins, and you'll see that a lot of intact protein available for the immune system to react to. Resistant to extremes in pH, and then also they tend to be the major source of protein within that food. So that those are the key contributing characteristics for the majority of food allergies. They don't necessarily have all of these potential points with each individual allergy. So again, specific avoidance diets are what allergic individuals need to utilize. And with that, there's a lot of issues that come along with trying to avoid allergens. Certainly, degree of selectivity of foods becomes much more limited, so you don't have as much available food. Knowledge of composition, so those individuals have to look through those package labels to try to understand how much, if that allergen is in that particular product. Sensitivity, as we've shown, can vary greatly, but can cause an issue in quite a few individuals at very low doses. Adequate nutrition generally becomes an issue in infants who may be allergic to cow's milk and then put on a soy diet and then become allergic to soy. So then you have the question of what do we supplement the infant with. In adult nutrition, again, there's a lot of different options, but again, they have to be quite diligent looking for different options that wouldn't contain those allergens. Restaurant meals tend to be where we see the majority of allergic reactions today. So as you can imagine, out on our buffet today, there's a lot of cross-contact with various food products. Someone unknowingly may take a spoon from one container and use it for something else. A good example is on the ice cream condiments there, where you saw peanuts as a condiment. If someone takes that spoon and uses it for the sprinkles, for example, there may be enough cross-contact that could cause an infection. Or perhaps some of those nuts unknowingly spilled into the sprinkles. So again, restaurants become quite an issue. For food industry, as you can imagine, they need to control risks throughout their entire production, whether that's at the R&D phase when they're thinking about what to put in the product, and then bringing it into the facility. And I mentioned these facilities are huge in stature, so they have to think about how they can manage the engineering and equipment design, how they can manage incoming ingredients. Their suppliers may source ingredients from several hundred different places throughout the world, and then how they can manage it and scheduling and cleaning to make sure there's no cross-contact, get it into the right package, and then of course utilize cleaning and sanitation to ensure there is no issue. I always say you can have the best allergen control program in place, but it really comes down to human error and training. So if you don't have every individual knowledgeable on what food allergies are, there's that chance that they could have unknowingly make an error in judgment or an error in something not reported, which could cause an issue from a food allergy standpoint. Test methods are available today. They use a similar basis to what our immune system is looking at. So we're looking at utilization of antibodies that are specific for proteins from that particular source, so peanut, for example. And these are able to give us that sensitivity limit of about 1 part per million, which is needed to ensure safety from a cross-contact standpoint in the industry. And these have the advantage of that they're very rapid. They can be utilized in the processing facility. A lot of companies are doing so today. There are also regulations that industry looks for, in which the major one was one that was mandated by Congress in 2004, which is called the Food Allergen Labeling Consumer Protection Act. In this one, prior to that, you had an issue of ingredient statements that may not use plain English labeling. So lecithin, as it used to be put in, may not necessarily mean the vast majority of consumers may not know that it's derived a lot of times from soy, or whey, which is derived from milk proteins or milk. So with this labeling system mandated and regulated by the FDA now, you have to call out those allergens or say contains those specific allergens in the formulation. What it doesn't control is what we call precautionary labeling, or may contain, or processed in the same facility, and things of that nature, which you've likely seen a lot of. unfortunately, from the allergic consumer, they're relying solely on the contain statements, trying to assess what these precautionary statements mean so that they can look through each and every ingredient in that formulation on that ingredient statement before they purchase. So you can think about doing that the next time you go out to the store. It's a very daunting task. It takes a long time. So a lot of these consumers know brands that they can purchase and will become very brand loyal. Unfortunately, these precautionary statements have been increasing in prevalence. They're becoming quite confusing for the allergic individuals. So by precautionary labeling, again, these are things such as processed in the same facility. I call out this particular product because it has one where it says, our vendors follow good manufacturing practices to segregate ingredients to avoid cross-contact with allergens. So, okay, it sounds like they're doing quite due diligence to make sure there's no allergen issues. Made in wheat, milk, eggs, and tree nuts. Okay, so are they doing this right and making sure there's no issues, or is there an issue because now they say it's shared equipment? So as a consumer, I'm quite confused about what this statement, it's a voluntary statement for the food industry to use, but what does that necessarily mean? Should I avoid it or should I not? With that, we see a lot of allergic consumers now actually not taking that risk into heart, and they're beginning to purchase those products that have various statements on them, like may contain or manufactured in the same facility. So in some categories, we see individuals, up to 40% of allergic individuals, actually buying that product and eating the product, which can be quite risky because some companies that are utilizing this in a proper way may have a legitimate chance of a sporadic exposure. So overall, again, I think there is a strong case for the increase in IgE-mediated food allergies. It is certainly a public health concern. There are a number of publications out there indicating that there can be quite severe allergic reactions. With that, food industry needs to continue to be diligent in how they're managing food allergens, how they're controlling those food allergens. And again, that helps both the clinicians and certainly the consumer have a better understanding of what they can